Hey guys, Dr. Better here, physical therapist, and I want to take a little bit of time to talk about pain. Now, pain is going to be very different depending on who's experiencing that pain. Obviously, I have a lot of patients that are in pain, different types of pain. I think it's important to understand and identify the tissue source that pain's coming from. Our body is made up of different tissue, and every single tissue is going to have kind of a different pain that's associated with it. We have our muscular tissue, right? We have tendons, we have ligaments, we have bone tissue, we have nerve tissue, and all those different types of pain sources that we're experiencing are going to be kind of variable depending on what type of tissue source it's coming from. If it's joint pain, it's probably going to be a little bit more stabbing pain. There's going to be an impingement, so it's kind of getting stuck and it's going to be sharp. If it's a muscular pain, if it's from a bruise, it's going to be more of a dull, aching pain. If it's from a hard workout, again, it's also going to be more of that muscular pain that I'm sure a lot of you guys have experienced. If it's a pulled muscle, it's going to be somewhat similar but more intense. I think that it's easier to diagnose a pain that's coming from a muscle because if you move that muscle, right, if you're shortening that muscle through a contraction, the pain's going to come on board. Nerve pain's a little bit different. Usually it's more of a radiating pain. It could come from your brachial plexus and down your side. If you have a bulged discs anywhere in your spine and it's putting pressure on those nerves, it's going to be a radiating pain down your arm, a radiating pain down your leg. It might feel like it's in the bottom, in the butt a little bit, and then goes down your leg. It's going to be more of a nerve pain. But if you can identify the tissue source, I think it's a lot more effective in the treatment and the outcome of being able to identify that pain. But pain even goes more than that. It's even more complex. There's actually 7 different centers in the brain that process pain. So when you start having pain from a dysfunction in the body and it starts to linger and it goes past that 3-month mark, your body's really solidifying different synapses that are really registering that pain. So even if you're able to identify the tissue source later on down the road and be able to address it, sometimes that pain, because it's been registered so often and so much from those 7 different centers in your brain, it creates that pathway, and it's almost harder to unlearn that pathway because there's so many different parts of the brain that process that pain. So it's really good to address it earlier on. It's gonna be a lot more beneficial in the long run to be able to help pain sufferers. But pain is very subjective. What I mean by subjective, it's personal to you. I do find that individuals that have had more pain over the course of their lifetime, not necessarily emotional pain, I'm talking about physical pain. Maybe they broke bones, maybe they're used to pushing themselves through sports, through working out. They can process pain a little bit better versus individuals that haven't really gone through a lot of physical pain in their life. When they do have it, it's a lot more intense, often because they don't really know how to process it. That's a lot more common with patients that I see that have total knee replacements, total hip replacements. You can really see that within the population. So I think it's good to start working out when you're younger. Get used to that pushing, get used to your joints, your bones, your muscles, your nerves, and everything, you know, actually going through the motions of having some physicality behind it. And I think that you're much more equipped to be able to handle pain. The body's made to move. Let's keep moving. But I hope that helps. If you guys have any questions regarding pain, please comment below, and I'll be more than happy to address those questions. I'm not here to diagnose anything, but just here to give you some knowledge on being able to identify that tissue source and hopefully help you guys decrease that level of pain that you're experiencing. Have a good day.